Hey, Will.
Hi, Tammy.
It's windy out there.
It is.
Dang.
It's a nice bit of like white noise, though.
Yeah. Until you're in it. What's going on with your job? How's it going?
It's going.
It exists.
It exists.
You sound thrilled.
Mm, I don't know. I mean,
I'm being sarcastic.
yeah. I
You
mean
don't.
the people there are I'm being treated well and things, so it's fine.
Well, it sounds like you're going to be having a lot of football for a little while because if you join us for the Seahawks game and then the next day is the Bears game and then the day after that's the Hoosiers game.
Yeah, it's packed 3 days for sure. Yeah, then also my AFC team is the Patriots, so I'm lucky to have two teams I like in the playoffs right now.
Mm. That one you can't come 2 hours.
Yeah, yeah. Oh,
No, that's fair. That's
yeah.
fair. When I arbitrarily picked them as my team way back in the early 90s, they were the laughing stock and they
Uh-huh.
became good and hated. So, it's like, hey, you know what? I'll take it.
Yeah.
No. And
Yeah,
they,
that's legitimate. You've been a true fan.
yeah. Yeah, but if that's where you're at, then I just have one thing to say, which is go Bears.
I would say that one's less arbitrary. My grandpa, um, one of my grandpas was very he liked, I don't know, he would just give random gifts to the grandkids, which, I guess it's fine. And I was single digits in age, and he got me one of those like, in like the late 80s, early 90s, they had like the shiny like jackets or whatever. He got me a Bears jacket. Um, and I wore the shit out of that when I was a kid. Like, I think at one point my mom was like, "That's too tight. You need to stop wearing it." And then when I was in middle school, my first ever, at least the first ever book report I can remember doing was on Walter Payton, aka Sweetness, one of the greatest football players of all time. So yeah.
Yeah, that's a solid choice.
Also, funny enough, the Bears beat the Patriots in the Super Bowl. I think it was 84 or whatever.
86.
80, yeah, 86, 86.
Isn't
So
that right, Whitney? It was 86.
Correct. It was the 85 Bears, but they played the end of January, January 26, 1986.
yeah, that
And
was
Whitney, is there a
And
reason you know
I
this?
think the last time the Super Bowl was in January was sometime in the 90s.
Yeah, Whitney and Tammy asked why you know the date so well.
I happened to be born during the third quarter of that game. So I will not be mad if this ends up being the 40th anniversary of the Bears winning the Super Bowl and they take it again. That will be an amazing year. I will love to celebrate.
Oh my God.
I love
Okay, well, I
when
guess our getting to know you needs to be like, who's your team?
I love when any Chicago team wins because it's like a more well-behaved Philadelphia. It's like they still riot, but like they won't burn couches or anything, Like they'll climb the light post, but like they won't also try and fight the police force.
Uh, oh, Kristen and Whitney, you're on the same thing. Pi, do you have a team or do you do this or is it not your thing?
I don't watch American football that much. I watch European football because that was a thing back home. But I do follow basketball and like I support the obvious Boston Celtics. So
It's not that obvious. So who do you support in European football?
I mean Manchester United, and that's only because my relatives were from this part of Manchester called Salford. And as a kid, I used to get football jerseys from them all the time. And that was the only team I knew, so I supported them, and I still do. They suck right now, so don't ask me why I still support them.
Wait, no, no, no. It's like, look at all these children being indoctrinated. We need to make like sapphires jerseys and pass them out to young children. Forget all this human factors. We're just gonna print jerseys. So Whitney, who is it for you?
It's the Bears.
It has to be the Bears. Okay.
Gotta be the Bears. I mean, I'm from the Midwest, so it's got to be a Midwest team, and obviously this year it's got to be the Bears. But we'll see. We'll see what happens. I mean, I
And
know
you,
I could say Broncos, but I'm going Bears.
mm, Kristen, any opinions here?
We don't watch sports ball.
Okay.
My husband watches hockey, but we'll be there on Saturday because we need to get out.
We were making
Okay.
plans anyways to double date, and so we just decided that that's what we're gonna do is come to that.
Oh, that's so exciting.
Hmm.
Okay, like tell us if you're coming and I'll just so I know how big a table to get.
There'll be four between
Four.
us. Yeah.
And Will? Okay, cool. Marilee, you have a team?
Well, I grew up, in the Kansas City area on the Missouri side. Not happy about the move to Kansas, but setting that aside, it's either the Chiefs and the other one would of course be the Broncos because we've lived out here long enough that when the two teams play each other, that's the most fun because it's like, yeah, I don't care. So, but those are typically the two teams. The other probably would be Green Bay from being a Madison grad.
Oh, right. Misa, opinions here? Any?
I also don't really watch football, but growing up in Idaho, I was surrounded by a lot of Seahawks fans. I guess I do have a soft spot for Brock Purdy because he's from Arizona. So maybe 49ers, but I'm not passionate enough to like stick with a single team.
Ellison?
Sorry. My child is in the one of two schools that got canceled today due to power outages. So I'm managing two things right now.
Yeah.
Um, yeah, I grew up, people were Bears fans and where I lived. But I just love the way Josh Allen plays. So I'm a Bills fan. So I'm definitely I'm all in for the Bills for a long time. I have a couple of friends
Mm,
um whose like brothers coach for them. So I've been rooting for the Bills for a while. They
mm.
have never managed to win, even though they have arguably one of the best quarterbacks. But yeah, so that's me.
Paul, do you want to speak about your obvious, you know?
Go Seahawks.
Yeah.
Yeah, I guess my second team, just because growing up in Delaware, is the Eagles, who were unceremoniously dumped last weekend by the Seahawks opponent tomorrow, 49ers. Um, yeah, seeing that three of the four teams on the NFC side are all from the Seahawks division and big rivals. It's like, oh, I'm rooting for Seahawks and Bears, and the other two can just go away as quickly as possible. Well, we'll see if that happens. And I'm gonna give a little bit of a shout out for Ellison. And one of our kids now lives in Rochester, but even before that, yeah, Josh Allen, University of Wyoming guy, he is just so much fun to watch.
Yep.
And the Bills have been so snake bit for so many years. I will say probably at this point, if the Seahawks lose, the Bills will be the next team I root for.
All right.
Who's left? But if it's Seahawks Bills in the Super Bowl, I can't do it. I can't go Bills.
No problem. No hard feelings.
I would say I have, oh, I never really paid attention to sports until I was with Paul, and then I got some things by osmosis. But this is, well, okay, everybody has a stupid reason to root for a team like they were. Not, it's not stupid. They're very sentimental, but they're not really obvious, right? They're not like, oh, I'm from here. In fact, I was probably 20 before I knew that the players on a team did not have to come from that town. And so I was like, what? What's the point of calling yourself that city team? But I've liked teams sort of in a political way, like in addition to living in Seattle a long time, the Seahawks draw from such a huge catchment area, like because there's nothing else around. And so it's just so cool to see like Alaska is all Seahawks fans, right? Or a lot. And the Bills are the same way because they don't have anything else around them. So I kind of like that. I mean, I have a fondness for the Packers because they are they still community or like owned by
Community
not a
owned,
rich
yeah.
person?
Yep.
Yeah, but I do hope the Bears have success too. So I don't know. I don't know.
Yeah.
And I'll be rooting for the Seahawks tomorrow. So
Yeah. I guess I didn't say why I started rooting for the Seahawks. If I grew up on the East Coast in Delaware, Steve Largent captured my attention. He was great. And so I became a Seahawks fan. But to Tammy's point, there's Seahawks fans everywhere. We were up in Grand Lake last week watching, and we were watching the Bears Packers game. Tammy went back and I stayed, and folks at the next table were talking about the game. I asked if they had a rooting interest. The guys from Bothell, Washington, is rooting for the Seahawks, and when it's their games. And when I was we were in some airport. I guess it was Chicago, taking the little rail from where we dropped off our car to get to the terminal in Chicago. And like half of the people in the car had Seahawks stuff on.
all right. So we're in good company.
Yeah.
Okay, folks. I want to talk. I'm super bummed that Erica couldn't be here today, but I am not bummed that the rest of you are here. Um, but Erica is also a rabid Seahawks fan, which is what gave me the idea to get together with her. Um, and invite the rest of you. Um, so it came up a while ago, like one of the features of this project is we're integrating physical, um, physical systems with how humans behave in them. And we're a little bit pushing like how to do that, why to do that, but not, I think not as much as we could. I think we have a collective understanding that isn't being brought forward as much as possible. And so it, oh dear pie. You live in downtown San Francisco? How, let's have a conversation about that later. That's like, I didn't know anybody could live in downtown San Francisco.
I mean, I think there's a lot of misinformation about downtown San Francisco, about like
It's
it being a war zone and
it's
like
not about
drug.
the war zone, it's about the cost.
Oh, it's so expensive.
Yeah.
Yeah, we don't have kids right now, so that's the only reason we can afford this. If you had kids, I would never live here. It's so expensive.
I would I would like to point out that the 49ers don't play in San Francisco.
Yeah, I know.
The Seahawks play in Seattle, but it's the Santa Clara 49ers. I mean, come on. Why does San
I
Francisco,
know.
No
I
way.
why should the
used to
city of San
work.
Francisco even care?
there are fans here who day trip down to San Jose to watch the match. It's just crazy. Oh my God. I don't want to look forward to angry 49er fans. Last time they lost the game, there was like angry shouting fans like breaking bottles against buildings until like 4:30 in the morning.
But does this not also happen if they win?
I mean, if they win, they have better places to go. They're like,
Like what?
if they win, they'll wreck around like the whole Santa Clara County. They won't bring that noise back here. But if they
Oh,
lose, since they're watching at home, they will, make the noise here.
okay, we want pictures, Pie. Okay, hey, let's talk about what Misa guys, okay, I give up. We're gonna spend the rest of the time talking about football. Uh,
The rules are a lot simpler.
I'm not sure.
No, they are. It's artificial, but there's artificial clarity. I think
Artificial
human
clarity, that's
factors is
fair.
like the antithesis. There's this.
No, we can. So this is what I think is that it's only people haven't bothered to write down the rules. There are actually rules, I think. But people don't write them down because they're like, oh, humans, it's so complicated. We can never predict them. And then I'm like, people are very predictable, right? Like, yeah, they're so-called irrational, but come on, you like and weird shit happens, right? Like extreme events happen, but that also happens in football, right? Like and baseball. When was the last time we saw that? Oh, and then somebody has the statistics. It was 55 years ago in this game, right? And we just don't do that for human factors. So I think it can be better. I don't know if it'll ever get great, but I think it can be better. Um, so so yeah. Yeah. An idea that came out of our paper discussion uh last last December or November, I can't remember, was Pi, you guys are writing we'll be writing papers about your results, but this sort of cross place between we should use human factors in IAQ and people are not doing it, and the human factors people who are a lot in driving and health, I think, but I don't know what else. Not really talking about IAQ. So how do we bridge that gap? How do we bring that forward? Um, and so we had the idea of doing a cross paper, and then Kristen and I were looking at the action items, and I just felt like that is so vague. We're never going to do it. Right? When you have a big, vague idea, it stays big and vague unless you kind of lasso it and wrestle it to the ground. Um, and so I was hoping to do that, and I hope we can get a start. And so I put forward something that's been knocking around my head, but I don't want to influence people either. I'm just curious if people have ideas, not like we should write a paper that connects these two, because those are just really hard to get your head around. But where would you place it? What would you say? So I'm going to just open the floor for comment. And I'd love to hear from people who are really close to it.
Yeah, so one of the things we thought about earlier is like looking at it like less of a IQ or a human factors thing and more of like a, you know, human understanding slash mental model type of paper where we can report
Mhm.
on perceptions rather than, you know, anything related to IAQ. We can frame it as how much do lay people understand about uh, air control interfaces in the first place, how much of their knowledge was improved from before the study and after the study, and that can prove to be a good paper. And I know that there are venues for that. I have some journals here that I had downloaded at the very beginning when I joined.
Mm,
uh, journal papers. Uh, Let me just give it's called Building an Environment.
hmm.
So yeah, I think that is a good venue, and I think that topic is something that Erica and I at least have some background in, like, the whole mental models aspect and the human understanding aspect. The other way we can spin it is like a design paper. So we can talk about the design, we can talk about the design elements of the interface and how effective that was, but I just don't know enough about air quality papers to make a comment from that side of things.
I can comment from the air quality side of things, and the perceptions there and what's been done in general. And a lot of it is exactly that. You're looking at perceptions and, understanding. I don't think there's been as much, I would say, done on looking at it from a mental model standpoint. Thinking about how they're thinking about the flow of air in a house, or how permeable a house is, and that some of that understanding, that perception. But there's been quite a bit of work done on people's perceptions of air quality, and then the influence that has on whether they're intending to change behaviors, or whether they have. Um, there's been a lot of work that's been done, um, uh, internationally, uh, because there's really, like, the really crappy air in China, and I've seen a lot done in the Southeast Asian areas as far as looking at perceptions and how that influences behaviors, and with different populations as well. There hasn't been anything that I've uh, seen, but I'll learn about this. I have to teach health comm in the spring, so like in the next week I've got to like learn a whole lot of crud again. But um, I don't think there's been much about like the perception of an intervention, and like how it would work. So that one of the things maybe, and I don't know, Pi, if this is something you're thinking of, but like an understanding of what what is air, what is air quality, that mental model of that, plus a mental model of how your house works, and then how this would work. Because I think um, that combination, and then how does that combination and further encourage the use of something, because I understand how this works, so I'm going to use it. It's not magic. And I also understand the health side of that. This is an important thing for me to do, or at least that this is a low level things for me to do, because all I have to do is I can get the system and it works and I don't have to worry about it, or I know I have the system I can turn on and off. And there could be, I don't know if there was any work done on people's perceptions of air filters during the pandemic, but that use itself of personal air filter, like in your house, things like that, we might be able to pull from there as well.
So, can I ask a question of both, Marilee and Pi? How much do people need to understand things in order to use them or be motivated to use them? Do we, there must be work on that, right?
I wouldn't, that's a real, okay, I'll speak first, Pi. Feel free to contradict everything I say. Not a problem. Um, it's, there hasn't been, okay, as far as I know. So again, that in the limited area that I've been in this area, or the your understanding of why something, how something works, if it's associated with the why, like why should I do this? There is that whole idea of, if you're telling me to use something, will it work? Thinking about self-efficacy, response efficacy, then we
Yeah.
believe that in that case, it can contribute. That if I tell you that the way to keep from getting the flu is to get a flu shot, and you believe that vaccines work, then you're more likely to get a flu shot. It
Mhm.
doesn't, or because you believe at least it's going to contribute to a yes. It's not going to go against it. We do know, of course, that the stronger lever to pull is the perception that you yourself can get it. That you've got the ability, the time, all that good stuff. Um, understanding how the thing works. Because I'm often like, well, I want to understand how this works before I'm going to spend a lot of money on it. So part of it, I would argue, Tammy, could be it's a like a an evaluation, a cost, a cost evaluation of how much is this going to help me? How much is it going to cost in time, in money, in inconvenience, and so on. And so that's why we look at characteristics of an intervention to see if those are um, positively perceived, because if the intervention is positively perceived, then we argue typically that that increases your attitude, which then increases your likelihood and so on down the road. So we
Yeah.
look at those those levers that have to be turned between I've seen it and I'm going to use it, because there's a lot of steps
Mhm.
in the middle ground.
Mhm.
Hi,
But
what
is
do you think?
can I
Oh,
just clarify on that before
yeah.
Pi respond or anybody else respond too? Um, in the beginning, or somebody mentioned, I can't remember who, the sort of airflow patterns and the building shell and all this stuff. And as I've been working with Kristen on the reports for Epic Homes, and we keep stripping out, like making it simpler and simpler, because Kristen is like, and people don't understand that. I'm like, I think they need some belief that it works, and they need a certain amount of trust.
Hmm?
But I don't know that people need to know absolutely everything.
And I would say they don't need to
And
know
sometimes it's
everything.
the way, even if I'm like, here, you have to understand how this works before you can use it, then that becomes a barrier. Like, oh no, I can't use it. It's too complicated.
So it is tricky. This is the why people go, this is a lot to deal with. um, but if you And so that's why we typically say, if you really want to be effective, you're going to be looking at particular target groups.
Hmm.
And then you could argue also that if you get particular target groups to adopt something, then they will also help to spread that adoption. But I would argue, yeah, there is, and it is a trade-off. So you're trying to figure out, how much do I need to tell you? I do need to build trust, because there are people who will say, and we see this a lot with medicine, like, I trust this doctor, I trust this organization. Consequently, I'm going to take part of the burden off of me of investigating it, because I trust you. And
Right.
so, that's we do, trust is key and trust is important. And then and if they don't already have trust in you, then you're working on building trust. And part of that is in being transparent, and having integrity, and all of those good things that are associated often with good communication.
Hmm.
So, uh, so that's another factor, that we're kind of like, do you know who we are? And do you trust that we're doing this out of a good place, and not that we just want to make a bunch of money?
Yeah. Okay, Pi, I want to hear from you.
I agree with Merle. I think distrust and disusage is like a blocker for acceptance or like adoption of new technology. And another thing is like, I'm not sure if this is still the case, but like, if these filters are going into like, let's say, low income households and stuff, uh, the extra cost that would come up with it could also be a blocker, and we'd have to justify how the technology helps them, what value the technology adds along with the costs in the homes as well. So I think trust is a factor. I think the lack of knowledge will be a blocker, but the lack of trust and lack of usage will be bigger blockers. So I think the gamble is to improve the knowledge and hopefully improve the trust by improving the knowledge. Because if we just outfit a home with a new technology without giving them the information of what that technology is being used for, they may be more suspicion than trust. So yeah, I think Marilee makes a good point.
And I do think you can sometimes like layer the levels of knowledge. We have more of an ability to do that than we used to because of, well, here's a website or something like that. And you can go in at a certain level. And if you get it, you're like, I'm good and I don't need to know more. But if you have people who want to know more, you provide those venues for them to learn more. That also builds trust because you're like, we're being transparent with you about what's going on. We're lowering a barrier to you finding out more by us providing those links or however we do that. But um, uh, those kinds of things we do. Information can help definitely, and that's not that difficult to work in, especially with the technologies we have today. To tailor it, the tailoring is on their end. They get to decide how deep they want to go. You make sure your interface is good. And I know Pi and Erica are great at interfaces and stuff, so they can learn more if they want. But if they don't want to, that's cool.
Danny's got a hand up.
I wanted to add a little bit some feedback that we got from working with some marginalized groups in Denver. And I forget if I shared this with the whole group, but something that was really interesting, like they absolutely said transparency, they want to know where the funding's coming from. Like they kept
Mhm.
grilling us. They're like, who's funding this? Who's funding this? Like if funding is coming from like we were working with some core down there or working, they were the subject of our project. Like if there had been any money coming from anyone in the petroleum industry, they would have been like, nope, get out. We don't trust you. So I think trust and transparency are critical. Something that was also really interesting that they said is that if the results and if the performance of the thing doesn't agree with their lived experience, especially I think if they're less technically knowledgeable, then that might be a reason that they might lose trust with the system. Like if they go
Mhm.
outside and they're like, air quality is terrible, it's super hazy, my kid's having an asthma attack, and the system isn't turning on, they'd be like, is this thing broken? Like, why did I even go through
Mhm.
this?
Mhm.
I don't know the fix for that, but I know that I think making sure that people understand that it's not always going to be on, even when the air quality outside is bad. I think that that would be really
Mhm.
important just for the education and transparency component.
Mhm. Cool, thanks. Anyone else on this? So I want to draw a distinction between a couple of things. So I think there's the things we're working directly on, right? Like, how do people respond? Is this should how do we get them to be engaged in the intervention, or how do we know when they will not be engaged? And so there's a sort of a mechanistic, like the interface has to be good, they have to trust it, something within this that kind of focus on this project, the exact things that we're working on. And then I think there's a broader understanding, um, or this broader integration of human factors in a couple of ways. Number one, um, okay, so I hate papers that are like these two communities should work together, and then with no uh, direction for how or what the barriers are, but I feel like there's knowledge that you have Pi as a human factors expert, Marilee you have as a science communication expert, that where people just don't check, right? And that they're and I don't know how to say like, here's how you would start doing that. And so for example, as we've talked about the interface, we often come up with ideas like, oh, we could test this against that, right? And or we could introduce this variation into the field study, and then I do something like really idea squashing, like say, no, we can only do a couple of things in the field study. We should have a different study that allows for more examination of that one thing. So why don't those studies ever come up? As in any other time, right? Why is this not why are many people looking at um how people respond to air quality information, or a few people, and no people are like generally integrating that type of interface exploration into their studies? I don't know. I'm probably being very vague. So that's number one. Like people just generally don't do that. And I don't think it's only because of cross-disciplinary barriers. I think it's not on the radar. Once things are on the radar, all kinds of people go looking at things. Some of them are not good, some of them are good, and then progress happens.
Can
So
I
why is
ask a
it?
question? A
Yeah, yeah, yeah.
clarification question? Do you mean like why don't you have a parallel? Why don't we do things in parallel, which is not that they don't talk with each other, but that you why, for example, aren't we from the very beginning on a project looking at the interface at the same time we're looking at the intervention?
Um, no, I thought we were though, or at least we're trying.
Right.
I
But
think
but
so
uh-huh.
if people are designing interfaces, I would say in interface design, there's not a group of people who are like, let's try to design the best air quality interface that we can, right? We're just doing it as part of the project because this has to be part of the project. And that's because the awareness of air quality has not been raised in that community.
I
Does
would
that
say
make
that
sense?
it does in part, but I would say there is a field and pi is in it in part, the human factor side of it, looking at these kinds of, I think I pi interface designs and research in that field, regardless of what in general, regardless of the topic, we would argue that it gives us some general ideas about how people would respond and how to build an interface that is going to be more usable, more trusted, and so on. So that I think that having people like Pi, Erica, and to some degree me on your team, you're already doing what you're asking to me.
So can I ask a question though to Pi? In the so you never design an interface without an application, right? You don't just sit around and like make a good interface for a random purpose. So what are
Yep.
the primary applications that you see working in the field that you do?
For me, it's like for when we work in transportation, it's mostly for on the safety side of things. So when like the part of the stuff that I do at Google right now is also the same thing. So we want to make sure that the interface that we have for Android Auto uh is not distractive enough that requires many glances off the road.
Mm,
So that's how we look at it from, the driving element is there, but it's not the primary element. It's more of how the user interacts with the interface.
mhm,
So driving and the whole transportation is side of things is kind of secondary. It's kind of like the base. We know how many glances is bad, right? We know
mm,
how many seconds of glances is bad. But what we're looking at primarily is whether those glances are happening or not.
hmm.
So
Okay, so
what
your application is driving and the
Mhm.
concern is safety.
Mhm.
And there's a lot of people looking at that, right?
Yeah, it's like a huge topic.
It's a huge topic.
Hmm.
And so if you had to ask the same question for air quality, the application is indoor air quality or indoor, some kind of indoor quality in general. What's the question and how many people are looking at it, right?
I so the thing is because everybody has a car and not everyone has air quality interfaces and devices. I think the question is not something that is being asked at the same rate. But in an ideal world, let's say like everyone had air quality filters in their home, right? And we would see the same amount of disusage of the filters, and that would lead to more people facing the hazards when by not using it. So then it becomes a safety question like, hey, everybody has an air quality filter, but why is no one actually using it? But we don't need to reach that ideal world to ask that question. We can ask that question right now. Like those who did have an air quality filter, did they use it or did they not use it? And if they didn't use it, why did they not use it? And what are our methodologies that we can employ to make sure that folks do use it when they have it?
And there's been some work I think done on that when we're looking at during an event in places where they've had some big events and they've built awareness, they're trying to, get people to not have knowledge of it, then it's a question of, is this important to them? Is it important enough for them to act? And when you have extreme events, you're more likely to get action because it's more, you see it, you smell it, it's in the news, people are talking about it. When you have low level events, typically those are easier to ignore. We all do that. But in a case like air quality, um, it's, you can have critical events, you can have acute, but you have a lot of chronic stuff going on.
Yeah.
And so that's one of the challenges I think with these kinds of issues is it is a chronic situation. You
Hmm.
don't, it's like having radon in your home. I mean, it's not like it's going to kill you tomorrow unless it's really, really bad, but maybe not even then, but over time. And so we've got that whole
Right.
idea of an overtime event. And that, I think, I've thought about that a lot. Not that I don't have any brilliant ideas, but it's a difference in the perception of the risk. And it's a difference
Mhm.
and there's a cost, um, a trade-off that people make, you know, in those kinds of cases. And trying to get people to recognize it and then to realize it's a low level thing you have to do. Turn on your air filter. There's a simple way to help yourself. Um, those kinds of things. And part of this is how do people perceive risks like this in general? And we do have some pretty good information across a number of risks about people's levels of perceptions of them just in general. Are they big? Are they little? Some things like that.
Yeah, and I think that forms another layer. I want to point, Ellison, I'm pretty sure you have thoughts about this, and you haven't. Do you have bandwidth to share your thoughts about the general place of human factors or any human thing in this?
Um, hmm. And I looked at what you had shared beforehand. I think where I struggle with the analogy is, um, well, I don't know if this holds up. Right now, it feels like what pie you work on for cars avoids an outcome that um is almost definitive. Like if you get into a crash, you will experience some harm of some sort, like financial, physical. It's not actually it's it's an elevated risk that you would ha potentially have lung cancer if you were exposed to radon at a certain level. Like they're just not comparable. I I don't I don't feel like I don't feel like the analogy holds up for aviation either. Like there isn't people aren't going to opt out of breathing their air in their home the way they'll opt out of like flying if it's uncomfortable or unsafe enough. But I could be wrong about that. I feel like one of the reasons there's not a drive to really solve human factors problems in indoor air quality is because the problem is not as bad. And maybe I'm wrong about that. Like I think this has become more of a bias I have staying in the field as long as I I just don't think it's as big of a problem.
I think that
I would
that
say,
the problem doesn't hit you I mean, I agree with you in part. I mean, this idea of there's a different perception of the problem, but one of them is we also talk about how awful will it be if that happens to you,
mhm.
and the thought of dying in a plane crash is pretty big. I mean, that's like, oh gosh, I've thought about that when I've flown sometimes, and then I
Yeah.
have to distract myself from it. Um, and I think the same happens with cars. There's also the trust comes in when you think about level of control, because in a car, you feel like you have more control because you're driving, or versus a plane where I have to trust somebody else. But I agree with you, Ellison. There is a difference. And I'm kind of wondering if there's this really fundamental difference in the way we do the calculation as humans. It would make sense to me that there was between a pretty much this is going to happen pretty quick to me if I don't do something versus this is an accumulation over time. This is why we have issues with people who have, like you're pre-diabetic and are you following following your doctor's orders that will keep you from becoming a diabetic? You
Mhm.
know, we've got analogies in other areas of health, and these are difficult. You know, things to, because then you've got to encourage long-term behavior change. And even if this is long-term attention to something, that can, but if you lower, my thinking is if you can lower the cost, both from a time and financially and all those ways of protecting yourself, it's in your home, just hit the button or it comes on automatically, then that's when we're likely to get savings. That's why we now have building codes that say we're putting passive radon systems into homes.
Mhm.
It's already there.
So I want to so one of the things that bugs me about this whole or about the field that's kind of negative a negative way to say it, but I think there's a lot of attention to getting people to do things. Um and I don't in a lot of other areas we don't have to get people to do things. Um so for example, you do not have to take action in this country in most places to get clean water, even though that is a thing that you really need to do for your health. People might prioritize it or not prioritize it. We don't really know. I mean, I guess we do know from studies in developing countries where clean water is not prevalent, but we don't have to think about it. And so I agree that things are there's a difference in acuteness of the effect. There's a difference in um, perceived connection. Um, I sort of agree that, yeah, if you get in a car crash, you're going to get hurt, but there's not a connection between those little glances away from the road and an immediate damage to yourself. So it is a small accumulation that people are treating differently. And one of the things that yes, I think aviation is very different. And yet I came to it through the back door of saying, what is wrong with this system? Not in sapphires, but in another thing that I'm doing, the project that I've shared with Marilee and Kristen and maybe some other people. And I ran into all these things where I'm like, this is really obvious and useful. Why are we not using these principles? And they're not about people's risk perception. They're about how people behave in society and in their environment and what they seek. And I was like, why do we not pay attention to them? I must be crazy. I must be crazy because nobody talks about power distance, right? And then I go to aviation and it's all there. And so, I'm not crazy, right? Because I think so it isn't to do with the individual's participant's perception of risk, which indeed is very different. Agree. But what it is the field that studies it does not um, have does not see the same relevance or criticality of including a wider systemic view. Like there may be work on how people perceive air quality, and then there's some general teeth gnashing, forgive me, about how people should think that air quality is more important than they do. Um, I'll get to you when I'm done, Pi. But there hasn't been a general question like, okay, people are probably not going to perceive air quality as very important, even though we know over the long term it's harming a lot of people. And that may be outdoor, maybe indoor, whatever. But those numbers are the same magnitude, depends on who you believe, but similar magnitude to automobile deaths. And yet there's a huge amount more work on auto safety, right? And so my question is not what about the participants seeing the risk and how we need to convince them to see it differently? What is it about the whole field that treats it differently? And so why I think we, uh, homes or other engineered systems should be more like aviation is that because people are so tuned um, to aviation, and so tuned to disasters, and they're so visible. They've had to create a system that prevents failure, and we have not had to create that system. And I think we can learn from that. So, let's see. Paul, your hand is up, but Pi was up before you.
So I think I veered us off in a very different direction by mentioning the whole car thing. I think I thought of better examples while people were discussing. I think instead of looking at higher risk scenarios like aviation and driving and transportation and stuff, we should look more towards in-home systems as well. So like interfaces regarding the new smart refrigerators, smart washing machines, and all of these things. I know the risk is less, but one of the negative outcomes that can happen by using these interfaces wrong is that you may lose your week's worth of grocery supplies. That is an economic risk, right? Use the washing machine wrong, you may like mess up that really expensive sweater you just bought, right? Like it's economic as well. So that could also those risks are lower than obviously like losing your lives or having a plane crash, but those are still risks. And I think daily economic risk is something folks do still care about. So in terms of the air quality filter, we can also say that, like I forgot who, but like the prolonged exposure to radon can give you health issues, and that could lead you to having these horrible respiratory diseases that may pose you economic trouble in the future. Maybe that is like something that we need to look at rather than look at it as an urgent problem that jumps out at you. Does that make sense?
Hmm. Paul, what's your thought?
Yeah, so I think that in some ways, I think that we are not as far behind as we're talking about. I think the acute versus chronic, or short-term urgent versus long-term maybe, is absolutely an issue. But look, there's been a lot of work, a lot of studies on carbon monoxide. There's been a lot of studies on lead paint.
Mm.
It's not that we're not doing indoor environmental hazards and having them become huge issues in the literature, in public consciousness, in policy, and all of that. They tend to be focused on the ones that have devastating consequences. CO can, you can wake up dead the next day, and with lead, permanent disabilities to small children. And then, that really tugs at the heartstrings. So, um, so there's that. I also think that people do care. If we think people don't care, then I see Marilee's comment, especially when it's indoor residential. That's the hardest air to regulate. Um, but people do care. But what they don't necessarily have is something to care about. They care about air quality, but what is it that they have to then think about? Like they care about food safety and they have to think about their refrigerator, except they don't anymore because everybody's had refrigerators forever. They think about transportation safety and they think about auto safety, they think about airplane safety. They have a topic and they have something about that to think about. What do they have to think about for air quality by way of this could be a solution? And I think that's one of the big things is that we tend to be much better at giving people things to tell them that they have problems. I've said this sort of thing before, than giving them things that could be solutions for them to now think about, is this something I want? So I think we are closer to some of what we've been talking about than maybe we think on air quality. And when I talk to residents, there's a lot of concern about air quality, but they've kind of thrown up their hands because nobody is bringing them something to work with for them to then even think about, do I like this? Do I trust it? Do I believe in it? What am I worried about?
I would agree with I agree with a lot of what's being said as a blanket comment, but thinking Paul about you have to have a target. So, and I put into the chat, like often in our country we will regulate things and we will like we get up in arms about how the internet is affecting children. It is also affecting adults, but we will not make a law about that in our country because in our country we have the right to do stupid things. As my sister, who was a nurse for many years, would say, you have the right to make a bad decision about your health. You're an adult. I may not like the decision made, but as a nurse, she would say, that's your right. Um, so I think that this idea of like, and often we will look at what is the group you are willing to make the sacrifice for? And sacrifice is a little strong, but we will often talk about what role do we want to talk to you about this in? Are we coming to you as your role as a parent, as a guardian, as a pet owner? Um, what will motivate you? Because motivation is another key piece of the puzzle here. In our country, we don't regulate a lot of things. We try in our country to do things by persuasion. So when you look kind of like the hierarchy of how we make change, how we cause people to make change, laws are at the very top. Like we'll make a law about that. But that takes us a long time to get to the law standpoint, or we'll have a policy about that. And one of the uh, disadvantages that public health has is that one of its biggest levers is persuasion. And it's a difficult one to use because there are lots of things you have to do to persuade someone to do it. And you have to consistently kind of keep persuading them or kind of re-upping them on that. Okay. We, again, part of this is we've got to think at the societal level. What is acceptable in our country as like, what decisions do you get to make and what decisions don't you get to make? And where will we have laws? There are some countries where there's a law about you can't have advertising targeted toward kids at certain times of the day. Don't have that. We've never had a law like that. I don't think we ever will have a law like that. So one of the things too is when you're dealing with humans is you have to look at those levels in which they live, their community, their the people that matter to them, that social norm, all of that does come into play, which makes it more complicated. I think part of the reason that this is not tackled as much, and one of the challenges in the fields that Pi and I and Erica work in, is there's a lot of complexity here that is very difficult to isolate. And you really can't look at it in isolation because all of those other factors are involved. So that I think is sometimes the reason that it's more like, well, let's build the thing, and then maybe we'll think about how it could be adopted.
Okay, well, we're near the end of time and we still did not have really any great concrete ideas. I think we're having like a discussion about ideas. Um and and I think where this comes from is we all recognize that there's some kind of gap in implementation, and it's generally having something to do with how people behave. Um, but there's still a lot of mismatch, and I don't want to write a paper that's about like I don't want to write another paper that's about how there's a mismatch and we're all screwed up. Um, but I don't. It feels like we're not yet asking the right question. It feels like we have the right we identify problems. Um, yeah. I don't know what to do with this discussion. Yeah, I don't know, Marilee. You can say that out loud.
Oh, it was more, I didn't want to interrupt what you were saying, and I didn't want to lose the thought that was in my head at that moment. Sorry. But I don't know if that would work. That like, okay, here's the formula. Here's what's worked for us. Here's how to do it. Um, that does make it so that when you have other groups that are like, well, how do we do this? Well, here's an example right here of how to do this. Um, and then that we all go on speaking tours and tell everybody we know about how to do it.
But I'm not sure
But
we do know how to do it. I think we're trying to do it. That's different from being successful
right,
at
but
doing it.
yeah, but I think that lessons on how to do it that worked and didn't work, and then how you might, do it, and then we do this again with another grant. I mean, that because I think there has to be the commitment to continuing this kind of work and saying after this project's over, all right, what would we do better next time? All right, let's go figure out a project and let's do it again next time, and let's figure it out. The build
Yeah,
the other issue
yeah,
for that
but
is
that,
it's expensive.
yeah, yeah, and I think I I I have more reflections on what I would do differently than like I would not again try to put everything in one field study. I just thought I had to make two. I had thought I had to make it look like we were all working together. Um,
But I think if you had, and so thinking about in your field, if there was a paper that showed, okay, here's a way to do like multi-step field studies that help to integrate these two areas, so that at the end, and the streams talk to each other based on what you've learned from this project, and
yeah,
then you try
yeah,
it,
that's an interesting
you
thought.
know.
Okay, we have to come back to this because we're at overtime now. But I think interesting thought about like how would you write a paper about the process of doing the work? Different question, but note that as something to come back to. Okay, number of problems solved, 0. Number of problems identified, 15. All right, folks. Well, thank you for the chat. Bye.